All right, so the first muscle we're gonna do is called the brachial radialis. The action of this muscle, it does elbow flexion, pronates to neutral, and supinates to neutral as well. The neurological level is your radial C5 to C6, and origin is going to be your proximal 2/3 of your lateral supracondyle bridge. The proper position, my patient's going to be seated. She's going to have her arms down by her side. My stabilization hand is going to be the lateral posterior distal aspect of her humerus, and then my resistant hand is going to be the proximal end of her radius and ulnar, or her wrist. Movement, she's just going to go into flexion, bring her arm up and go into flexion. And we're going to do it bilaterally. So we're going to start off with the compensation, making sure she's not leaning to one side, winging out. So put your arm by your side, yes, and then go ahead and bring your arm up. There you go. So she can do that by herself. That's a 3 out of 5. So stabilize and apply some resistance. Go ahead. And that is a 5 out of 5. All right, face this way. Perfect. That works. All right, go ahead and go do yourself. That is a 3 out of 5. Go. And that is a 5 out of 5. All right, so next we are going to do 2 muscles at once, or at the same time. We're going to do the lateral tricep brachii, and we're going to do the medial tricep brachii. Words. Actions of these muscles, they do elbow extension and shoulder extension and adduction. Neuro is going to be the radial C7 to C8. The lateral head originates off the infraglenoid and the proximal lateral posterior humerus, whereas the medial head originates off the posterior medial shaft of the humerus. They both insert on the olecranon process, and proper positioning for this is going to be patient's going to be supine, and my stabilization arm is going to be at the distal humerus for both, and then at her wrist for resistance. Action of this for the lateral patient is going to be, patient's going to be 90 degrees for her arm horizontally, and she's just going to go straight up. And then for the medial head, the patient's going to have her arm this way. So we'll start off with the lateral. So, and compensation to watch out for is them bringing the arm too far back or too forward, or using her back muscles to hike up. All right, so she's going to do it first. So go ahead, bring your arm and hit my hand. That's the lateral. She can do that. That's 3 out of 5. Apply some resistance. Go ahead. All right, relax. She can do that. That's a 5 out of 5. Bring your arm down. Let's go on this side. And I would usually go on the other side. So bring your arm up, hit my hand. That's a 3 out of 5. Go. And that's a 5 out of 5. Now for the medial head, she's gonna have her arm like this. So go ahead and bring your arm up and hit my hand. She can do that by herself. That's a 3 out of 5. Go. And that's a 5 out of 5. Bring your arm down. This one. Hit my hand. That is a 3 out of 5. Go ahead. And that is a 5 out of 5. All right, the last muscle we are going to muscle manual test is going to be the supinator. Basically what this muscle does, it does what it says. Forearm supination. Neuro is going to be the radial at C6. Origin is going to be the lateral epicondyle, and the insertion is going to be the lateral upper 1/3 of the radius. Patient proper positioning is going to be supine, seated, or standing. So in this situation, my patient's going to be seated. Stabilization point is going to be the elbow, and then my resistance hand is going to be the distal forearm. The direction, the movement of this is my patient's gonna start in pronation, and then she's gonna supinate, and you gotta make sure your elbow is flexed. Compensation for this is just patient not properly, have her arm flexed out to the side or too far in. So we're just gonna start off supinate, pronated. Yes, go ahead and do it yourself. So she can do that by herself. That's a 3 out of 5. Go ahead. And I'm gonna make sure to take the slack out and go. And that's a 5 out of 5, my bad. Make sure to properly stabilize the elbow. All right, right there. All right, so go ahead, start in pronation. Go. She can do that. That's a 3 out of 5. All right, make sure to take the slack out. Go. And that is a 5 out of 5.